there. The next thing I want to talk about briefly is calibration, because there are some things that we can do in the software that helps make our testing run easier and our results are seen a bit more smoothly. So again, we're back in the patient. We've selected our protocol. We're back on the screen. And what we're going to do, we're going to go over here and click this calibration button. If I hit start on this screen, by the way, it's just going to run or try to run straight into your first test without you calibrating. We always want to calibrate first, no matter what your first test is. This is just the first one set in our protocol here, but whatever the first one is, it's going to prompt you to calibrate first. So we'll click that and it populates the screen. Now what you'll see for this patient, now that we have her eyes here on the screen, her eyes are a bit offset. That right one's a bit higher than the left. And so one of the first things I want to do is kind of get the eyes situated on the screen to where it's easiest for me to see them. So I'm going to hover right here. I know you don't see anything right here, but if you hover your mouse right around in this area here, these set of icons are going to pop up and it's going to give you some options to make changes with the eyes here. And so if I click this first one here, this one's going to allow me to center the eyes. So when I click that, you saw here that the eyes were centered. So again, we'll go back. This is where they were. When I click that icon there, it centers the eyes. Now, I will say you want to make sure that your patient is looking straight ahead when you try to center the eyes. If they're looking away, it might actually move their eyes completely off the screen, and it's really hard to get them back on the screen. And so you want to make sure that they're staring straight ahead and there is a dot that they can look at while they're doing the calibration so that we can get their eyes centered appropriately. The next thing we want to do though also is, well, before I get to that, let's look at the toggles. So this one on the far right over here, we can toggle the left eye off, or I can go back to the other side and toggle off the right eye. So if I only wanted to see one eye for whatever reason, I only have to see one eye at a time. Sometimes someone has very poor vision on one side, or maybe they have a lot of scarring, or I can't get this little plus sign. If you guys see how the plus sign's really locked onto the pupil, if it's bouncing around a lot, our tracings are not going to look very pretty. And so sometimes I'll turn one of the eyes off just so I can get nice tracings. Few reasons why we do that. I don't do that all that often, but you have that as an option. The other thing is this button here. So this is our toggle threshold sliders. And so what this does is it allows us to add and subtract contrast to the eyes. So this is kind of our default, but watch what happens when I take this slider over here on the left and drag it up some. It's added a lot of darkness to that eye. So again, we'll go back. Lots of light is let in, but now when I shift it up to here, it's made it very dark. So I usually will toggle those up and down. It's just you click and pull it up and down to slide it. And I usually do that so that I can get the plus signs locked on pretty good. So for this patient, I set it about right here so that I had enough darkness that it's really focusing in on the pupil, which should be the darkest point on the screen here. And another reason why you want to make sure that patients don't have any eye makeup, eyeliner, mascara, anything like that on, because it can cause this to be more difficult. But this can help in that case, even if they don't, whether they have eye makeup or not. Okay, so we've made some adjustments on the eye. Now we're going to start calibration. Now, when we do the calibration, you'll see this little, it's almost like a plus sign in the middle of the screen. There's going to be a green dot that kind of bounces around here. And so on the screen, it's going to go to the center and it's going to go left and right. And then here's what it looks like when we go up. So it's checking off the points as it's getting the calibration where we like it. If for whatever reason you're trying to calibrate, say this left eye over here, the plus sign is not locked on the pupil, it might not accept this point. It might not say that this is a good calibration. You can override that by simply going over to the accept point button and clicking that. So you just click the accept point and it will move on to the next part of the calibration. But if we run our calibration and it's bad, say the patient wasn't able to do it, or maybe the contrast was really bad, we can make some adjustments and try again. I usually try to at least try one more time. And so in this case, because the calibration is bad, we've got all these X's in the middle. I can't accept and close out of the calibration because it's not good. So it's giving me two options. I can either redo all of the calibration, which doesn't take that long, or I can use default calibration and close out of here. I really try not to do that. I only do that in cases where I'm having a lot of difficulty trying to get the patient to stay on the target. And And again, not too often. So I try to redo at this point, reinstruct and make sure that I've got my contrast really good on the eyes. And once we've got it good, so if I hit redo or use default, either way, if I go to redo it and everything checks off good, now this accept and close is highlighted over here because we've got really good calibration. Everything's checked off, um, and we can move on to our testing. So we'll click accept and close, and we are ready to move on. So then it takes us back out to that main screen to the first test that's in whatever protocol we've selected.